Its topic reading and interpreting medical records. Introduction. Accurate reading and interpretation of medical records are fundamental skills for medical billing and coding professionals. This module focuses on developing the ability to understand clinical documentation effectively, ensuring precise coding, billing, and compliance. You will learn how to navigate various sections of medical records, extract relevant information, and interpret medical language accurately. Importance of reading medical records. Foundation for coding. Medical records provide the detailed clinical information necessary to assign correct diagnosis and procedure codes. Legal documentation serves as a legal record of care, compliance, and billing accuracy. Communication tool facilitates effective communication among healthcare providers, coders, and billers. Components of medical records. These include history and physicals, often referred to as H&P. It describes the patient's medical history, current health status, and physical examination findings. Progress notes. It documents ongoing patient care, treatments, and responses during hospital stays or outpatient visits. Next, diagnostic reports. This includes lab results, imaging studies, and other diagnostic findings relevant to patient care. Next, operation reports. This includes detailed surgical procedures, techniques used, and interoperative findings. Next, consultation and specialist notes. It provides expert opinions and assessments related to the patient's condition. Next, discharge summary. It summarizes treatment course, diagnosis, procedures, and follow up instructions. How to read and interpret medical records, identify key information, look for documented diagnosis, procedures, and findings relevant to your coding tasks, understand medical language, use medical terminology knowledge to decipher complex descriptions, recognize relevant data, focus on the identification of services, specific procedures performed, and the clinical rationale, assess completeness, ensure the documentation supports the codes to be assigned. Incomplete records can lead to errors. Look for special instructions. Note any modifiers or specific details that influence coding. Next, practical tips for interpreting records. Use medical terminology skills. Break down complex terms into known roots, prefixes, and suffixes. Cross reference documentation. Compare different parts of the record for consistency. Next, ask clarifying questions. When information is ambiguous, consult clinicians if possible. Next, stay informed. Keep current with medical terminology, anatomy, and coding guidelines to interpret records accurately. In summary, mastering reading and interpreting medical records is essential for accurate coding, billing, and compliance. This skill ensures that clinical documentation accurately reflects patient care, which directly impacts reimbursement, legal protection, and quality reporting. With practice and solid understanding of medical language and records components, you will greatly improve your effectiveness as a medical billing and coding professional. Thank you.